Hi, this is Bella Mehta from Room Now at ACR 2022. We have with us Candace Feldman from Boston, and the abstract that I think we are going to discuss is 1099. It's empowering patients with lupus through their photographs, a photo-voice method to understand social determinants of health. So, Candace, very interesting abstract. So, what did you guys do?
Sure. So this was a study that we did where we gave our patients, who are individuals with lupus, who had a medical or psychosocial complexity or both, and we gave them cameras, disposable cameras, or we had them use their smartphones, and we asked them to take photographs of things in their environments that they felt affected their health. So their neighborhoods, where they got their food, where they accessed their health care. And then we interviewed them once we had their photographs, and we had them narrate their photographs with us and tell us sort of the story of their lives and their environment and how that affects their lupus, how it affects their lupus care, with really this attempt to understand the influence of social determinants of health on lupus care.
That's very interesting because sometimes you don't get an insight into what's going on in their daily lives, and this seems like an attempt to get to that so that we can help them. What were your key findings?
Sure. So I think, one of the things that we were interested in is we were trying to understand what are the recurrent themes that patients are showing us pictures of. So one thing that one of our wonderful research assistants, Yassia Ulis, presented today is she showed photographs of stairs and what an obstacle that was for patients. So, and the descriptions that they gave of how they, for example, got their groceries up the stairs, or who in their family supported them to actually literally physically help them up the front stairs of their house. We also learned about aspects of people's neighborhoods, whether it was neighborhood safety or the neighborhood advocate or the person who kind of looks out for their neighbors. So this idea of neighborhood cohesion and how that impacts people's daily lives. We learned about the centrality of food and barriers to accessing food, whether it was an issue of food insecurity or whether it was more of a mobility issue of, I just don't buy food that's on a lower shelf because of my limitation bending down. So we learn sort of the features of people's environment that really kind of directly help impact their health and just impact their daily lives.
And you've done a lot of work on how neighborhoods affect patients. So this is sort of zooming in a little more, right?
Exactly. So I think, a lot of the other work that we've done has been more like a bird's eye view to say like, oh, you live in this neighborhood, what is the average median income of houses in that neighborhood, for example, and how does that impact how individuals living in that neighborhood access care. But this was really a deep dive into the lives of 7 patients where we asked them to, tell us everything and then to be the ones to narrate the story, which I think was the power of this project compared to some of the others.
True. And I think that with the advent of social media, TikTok videos and Instagram, and a lot of patients with lupus who are young, who do access the world like that, I see that there is a lot more that kind of data that we can get from there. What are your next plans? Are you planning to use more data from open source stuff like that?
Yeah, it's a great idea. It's sort of going, in some ways, it's sort of a merge of two worlds, right? In some ways, part of what we're doing is almost like recreating the old school physician who goes to people's homes to provide care, right? And really trying to understand where a person lives and how that affects their health with the kind of new era of, how people interact with social media and smartphones and, how that impacts their health. So I think, so a big piece of this is sort of how do you almost like merge the two to see how both can be leveraged to improve our understanding of people's health and also intervene to improve people's health. So, one of the things that we're doing is we're incorporating this method into a number of other studies. So, for example, we've already incorporated into a study of medication adherence to see where people, for example, keep their medications, because that is a sort of piece of, well, if I know where you keep it, it could maybe help give me a clue of how I could remind you to take it. So that's
interesting. That's the way we think of how we as caregivers in our own families do, right? Where do you keep your pills? That's the first thing you would ask somebody who's sick in the family.
Exactly.
So I like the new Sherlock Holmes method, sorry. But with that, any last thoughts? Anything that you want people to take away from this?
I think that one of the things that for us was really powerful was, in the past, we as researchers are the one asking the questions and sort of guiding the topics that we want to understand. And the power of this method is that you're giving that microphone and that camera to the patient and they're guiding the questions. And for me, that was really powerful and really helped redefine the way I think about research.
Great. Thank you so much for your time. So this is the interesting Photovoice technique in research now. And with that, signing off, this is Bella Mehta at Room Now. And if you can follow me for more content on Twitter, Bella_Mehta. Thank you.